Hello students, do you want to become a future radiologist? Future radiologist. So what is a radiologist? So as you can see up here, these are professionals workers. These are healthcare workers who specialize or have specialty in radiology. So they do different fields of radiology. So radiology is not just a general field, but it's very broad, and there are many positions, many jobs that can be included in the study of a radiologist. Okay, so you can become like a radiology technician, a radiology technologist. So it depends on what area of need you want to focus on. Okay, so what is future? Okay, so you have a future, I have a future, everyone has a future. He So the word future can be used in two contexts. This can be an adjective or a noun. So it depends on the situation. So the word future can be an adjective or noun depending on the part of speech of each statement or each situation. Okay, so in this situation, that's future wife will be an executive administrator for a big company. So this is an administrator. So if he or she is an executive administrator, that person is in charge. It's more like a boss, a manager who oversees a company. Okay, an executive administrator. In this situation, that will have a wife in the future or later on in life. In situation B, Claudia's future seems bright because she will be a great radiologist after studying at a college. In this situation, a time, not now, not the past, but sometimes later on, that Claudia will become a radiologist. It means that something she wants to become at a time after today. So as you can see in two situations, you future as a noun and future as an adjective. So in situation A, that's future wife. The word future modified wife, so it's an adjective. In situation B, the word future is an idea, therefore it's a noun that discuss about the future of Claudia. So look at situation C. Joanne wants to have a good future, so he studies and works hard each day, not today. Okay. Fat's future's life will include having a big house, a pretty wife, and a wonderful family. So in situation C, Joanne's want to have a good future. This is an idea. In situation D, Fat's future's life. The word future modified life. So in situation D is an adjective, but situation C is a noun. Okay. So what is a radiologist? Okay, what is a radiologist? So as you can see here, these are different images that people who in the field of radiology work on. Okay, so here you can have an X-ray. This is called a CT scan, and this is called the MRI scan. So remember, the CT scan and MRI are almost similar. However, the CT scan is basically taken X-ray images, but where you have the MRI, the person go straight into the machine and they will close the door and take a picture. But here, the machine scan through your body. That's why it's called CT scan. Okay. So what is a radiologist? The word radiologist is pronounced radiologist, not radiologist, radiologist. So a radiologist is a medical doctor who specializes or has specialty in looking or diagnosing at medical images, or which is X-ray, and we call this as radiology. After looking or diagnosing at medical images, the radiologist will consult, talk, or discuss with referring physicians to make decisions on how to treat patients' injuries and diseases such as cancer and heart disease using medical imaging radiology. Procedures such as X-rays, CT or computed tomography, magnetic resonance imaging, MRI, nuclear medicines, positron emission tomography, PET scan, or ultrasound. So these are the different departments or different fields that a radiologist will have to do. As you can see here, this is a radiology lab that a radiologist will work. As you can see here, you have what you call a CT scan device. This device will scan an individual to take X-ray images. Okay, so as this is one of example of a radiology lab where a radiologist, radiology technician, radiologist, radiology technologists work. Okay, so in this situation, a radiologist is a medical doctor, but before a person who is sick need to see a radiologist, have to talk to a referring physician. The referring physician is a family doctor, is a regular doctor who refer patients to a specialist, which is a radiologist who specialize as taking photos of the person body, basically taking the inside the picture to look at the internal organs. They want to see the inside of the heart, the inside of your stomach, the inside of your brain, to see what's going on, what affects the way your body functions. Okay, so that's what the radiologists do. They take images, and the image that they take is called radiology. But before you see a radiologist, you first have to see a referring physicians. So radiologists also talk to patients about their procedure results. So patient can see and hear about their test, who specifically trained to interpret the test. So even though the referring physician understand about the anatomy of a person, but the physician may not have the medical expert looking at images or that we call radiology. So the physicians and the radiologists talk to each other. Talk is the same thing as consult or discuss. So they talk to each other. But the radiologists also talk to patients about their test results. So people who are sick and need to see a radiologist often see their regular doctor first. So after talking and discussing with the patient's potential symptoms or signs of illnesses, so remember, if you cough, chances are you may have a cold. That is a symptom or signs of illnesses. Family doctor refer or send people to radiologists for certain procedures. So this is what a radiologist does each and every day at his or her office or at work. Okay. Now, how can you become a radiologist? Well, there are many steps to become a radiologist. Okay. First, you have to complete high school. Okay. So then after that, you have to complete undergraduate study in biology, physics, chemistry, math, or any other pre-medical majors or science majors. Undergraduate means after you finish high school, your first 4 years or first 5 years of college and university is called undergraduate. Then you have to take what you call the MCAT. The MCAT stands for the Medical College Admission Test. Well, before you can be admitted to a graduate school to study radiology, you have to take the MCAT to see where you are in terms of preparation for medical school. So after you take your MCAT, you apply to a college but it has to be graduate college, and you study radiology. It might take you 4 more years to study, depending on the colleges where you study. Okay, college, you can go to college and university to study radiology. So after you study your graduate requirement, you will complete what you call the radiology residency. So the residency is normally 4 years. So, um, well, you have high school diploma, you have a 4 year college degree, you finish your graduate study, which can take you 4 more years, um, or 5 or 6, depend on how long you take. Then once you finish your study in radiology, you have to do what you call a radiology residency. This is where you go to like a hospital or um, a clinic to practice how to become a radiologist in different fields of radiology. So the radiology residency is 4 years of hands-on practice to see how you can use your theories that you study and apply in real life situation of helping patients. When you do your residency, you work directly with a supervised doctor. So when you are in the radiology residency, you are actually called resident doctor. So, well, before you finish your radiology residency, you may considering taking what you call the medical licensing examination. Without this test, you cannot be licensed to practice as a medical doctor. So, and then after taking this test, you also have to take another test called the board certification test. So these are the two exams that radiologists have to take before he or she can become a radiologist. So many tests that you have to take. Okay, first the MCAT to gain admission to graduate study. Then you have to take the medical licensing test. Then you have to take the board certified exam in order to become a doctor. Well, once you pass these two exams, you have to try to get a job or open your own clinic. If you don't have a job and you don't have a clinic, you cannot become a radiologist. Okay? Then you become a radiologist. So you can see here, these are basic 9 steps that a person needs to do to become a successful radiologist. So on an average, it takes a person about 13 years of education after high school to become a general radiologist. Now, if you want to focus more on specialty of radiology, then you have to take additional training and education, and it will take more years to study. So this is the step in terms of training and development for a person to become a radiologist. So, how much does a radiologist make? Well, it depends, but on the average, salary for a radiologist in the United States is about $360,000 to about $500,000. So that's a lot of money for 1 year. You can actually become a millionaire after working for 2 years. Yeah, for over a year and a half or 2 years. So you can actually become a millionaire. Wow. Okay. So what is the unemployment rate for radiologists? Unemployment rate means what is the chance that radiologists cannot find a job? Well, people are sick. So sick people needs medical doctor. So the unemployment rate for radiologists is 0 to none. So this is a good field to study. So according to the United States Bureau of Labor Statistics, employment for physicians and surgeons, including diagnostic radiologists, is expected to increase faster than the average 7% from 2018 to 2028. So this statistic is good. The growing population in the United States and the expansion of healthcare industry are the reason for this projected growth. So this is a good signal for people who have an interest in studying to become a radiologist. So once you graduate and become a radiologist, chances are you will have a job, a guaranteed job with high pay. Well, if you don't want to become a radiologist, you can study radiology and become, for example, radiology technologist or radiographer, radiology technicians, ultrasound technicians, MRI technicians, CT technician, and other fields relating to radiology study. So remember, these positions take less time to study. Okay, so if you take less time to study, of course you will get paid less compared to a radiologist who can make an average of about 360,000 to $500,000 for 1 year. So this is the journey to become a radiologist. So what is your future like? Do you still want to become a radiologist? Share with me. If you like the video, please subscribe and like so I can continue to produce more video. Thank you so much.